Picture this, you're in the final moments of labor. The pushing has started, everyone's cheering you on, but things have kind of slowed down. Sometimes, both mom and baby just need a little extra gentle help to cross that finish line. And that's exactly where an assisted delivery can come in.
So, what does happen when childbirth needs that gentle assist? It's a question a lot of expecting parents think about, and honestly, one of the most common answers is a procedure known as a ventouse, or vacuum, delivery. Let's really dig into what that actually means. So, a ventouse delivery is basically where a small, soft cup is placed on the baby's head. A vacuum then creates some gentle suction, and that allows the doctor or midwife to help guide the baby out. But here's the key part. They do it during a contraction, working with the mother's own pushing, never against it.
And really, the whole thing boils down to this very simple, very effective formula. You've got the cup on the baby's head, you create some suction, and then you add traction, which is just a careful pull. And that all adds up to helping the baby be delivered. It's a wonderfully straightforward idea for what is, of course, a very delicate procedure.
But, this procedure isn't just used on a whim. Before it's even on the table as an option, a whole series of critical conditions have to be met. You can almost think of it like a pilot's pre-flight safety check. It is all about making sure everything is as safe as possible for both mom and baby.
And this checklist, it is absolutely non-negotiable. The cervix has to be fully dilated, the baby has got to be in that perfect head-down position, and their head needs to be engaged. That just means it's moved far enough down into the pelvis. Of course, you need a skilled operator, and the family's informed consent is an absolute must. Every single one of these boxes has to be ticked.
So once all those safety checks get a big green light, what does the procedure actually look like? Let's walk through it step by step so you can see just how controlled and methodical the whole thing is.
First up, you have to choose the right tool for the job. There are two main types of cups. You've got the soft or celastic cup, which is gentler on the baby's scalp but might pop off a bit more easily. Then there's the rigid or metal cup, which gives a stronger pull for more difficult deliveries. The choice really just depends on the specific situation. The procedure itself follows 5 very clear steps. It all starts with preparation, making sure mom and baby are in the right position. Then, the cup is carefully applied to just the right spot on the baby's head, and the vacuum is built up slowly. Now, step 4 is the most important part, traction. The gentle pulling only happens during contractions to work in sync with mom's efforts. And finally, once the baby's head is delivered, the suction is released, the cup comes off, and the rest of the birth can be completed.
All right, so like any medical intervention, a ventouse delivery has its own set of advantages and potential risks. It's really key to understand this balance to be fully informed.
The main advantages are often for the mother. It generally causes less trauma than forceps and usually requires less anesthesia. It can also be quicker to apply. Now on the flip side, it does take a minute to create that suction, the cup can sometimes slip off, and, this is a big one, it's not an option for babies born before 34 weeks.
And what about potential risks? Well, for the mother, there's a possibility of some vaginal tears or discomfort. For the baby, the most common effects are temporary. Things like swelling, some bruising, or a slightly higher chance of jaundice, which is a really common newborn condition. It's so important to remember that serious complications are very, very rare when the procedure is done correctly.
And this chignon is that main side effect for the baby we were just talking about. It's basically a little temporary swelling, a bump right where the cup was placed. And while it might look a bit unusual right after birth, it's totally harmless and typically disappears completely within just a day or two.
So how does the ventouse stack up against that other well-known tool for an assisted delivery, the forceps? Let's put them side by side for a little showdown.
The key differences become pretty clear when you look at them like this. The instrument itself is totally different, a suction cup versus what look like large metal spoons. This changes where the primary risk is. With a ventouse, it's focused on the baby's scalp, while with forceps, it's more about the mother's tissues. This is also why a ventouse often needs less anesthesia. But a really crucial distinction is that forceps can be used on preterm babies, whereas a ventouse cannot.
And here is one of the most important safety protocols built into this entire procedure, the 3-pull rule. There is a maximum limit of 3 attempts, 3 pulls. If the baby isn't delivered within those 3 pulls, the procedure is stopped, and the team will move to another plan, like a cesarean section. This just ensures the process is never dragged on unnecessarily.
So we end on this question. When nature needs a bit of a helping hand during one of the most intense moments of life, is a technology like the ventouse a comfort?
knowing there's a safe and effective backup plan? Or does the whole idea of an instrumental assist still feel like a concern? It's really a personal reflection on that incredible balance between medicine and the natural process of birth.